COVID-19 is a new illness that can affect your lungs and airways. It's caused by a virus called coronavirus. There is currently no vaccine to prevent coronavirus disease, also known as COVID-19. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person, between people who are in close contact with one another, within about 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. As of March 6, 2020, COVID-19, there are 1,685 cases reported, out of which 3,411 deaths are confirmed. This brings the mortality rate at 3.4%. Coronavirus symptoms range from mild to severe. It takes 2 to 14 days after exposure for symptoms to develop. Symptoms may include fever, cough, shortness of breath. Those with weakened immune systems may develop more serious symptoms, like pneumonia or bronchitis. The coronavirus can be spread through contact with certain bodily fluids, such as droplets in a cough. It might also be caused by touching something like an infected person or contaminated surfaces and then touching your hand to your mouth, nose, or eyes. Don't go out if you are feeling sick or have any cold or flu symptoms and consult your doctor. Stay at least 3 feet away from anyone who is coughing or sneezing. Coronaviruses can survive on surfaces for over a day. Avoid travel to outbreak areas. Stay away from crowd or crowded areas. Stay more than 6 feet away from anyone with coronavirus. Steps to protect yourself. Clean your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place, or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Steps to protect yourself. Avoid close contact. Avoid close contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community. Cover coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% of alcohol. Clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Steps to help prevent the spread of coronavirus if you are sick. Stay home if you are sick, except to get medical care. Avoid public areas. Do not go to work, school, or public areas. Avoid public transportation. Avoid using public transportation, ride sharing, or taxis. Steps to help prevent the spread of coronavirus if you are sick. Wear a face mask if you are sick. You should wear a face mask when you are around other people, for example, sharing a room or vehicle, and before you enter a healthcare provider's office. If you are not able to wear a face mask, for example, because it causes trouble breathing, then you should do your best to cover your coughs and sneezes. People who are caring for you should wear a face mask if they enter your room. Steps to help prevent the spread of coronavirus if you are sick. Separate yourself from other people and animals in your home. Stay away from others. As much as possible, you should stay in a specific room and away from other people in your home. Also, you should use a separate bathroom, if available. Limit contact with pets and animals. You should restrict contact with pets and other animals while you are sick with COVID-19, just like you would around other people. Although there have not been reports of pets or other animals becoming sick with COVID-19. Steps to help prevent the spread of coronavirus if you are sick. Avoid sharing personal household items. You should not share dishes, drinking glasses, cups, Eating utensils, towels, or bedding with other people or pets in your home. Wash thoroughly after use. After using these items, they should be washed thoroughly with soap and water. Clean and disinfect. Practice routine cleaning of high-touch surfaces. High-touch surfaces include counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, and bedside tables. Disinfect areas with bodily fluids. Also, clean any surfaces that may have blood, stool, or body fluids on them. Household cleaners. Use a household cleaning spray or wipe, according to the label instructions. Labels contain instructions for safe and effective use of the cleaning product, including precautions you should take when applying the product, such as wearing gloves and making sure you have good ventilation during use of the product. Monitor your symptoms. Seek medical attention. Seek prompt medical attention if your illness is worsening, for example, difficulty breathing, fever, cough. Call your doctor before seeking care. Call your healthcare provider and tell them that you have, or are being evaluated for, COVID-19. Wear a face mask when sick. Put on a face mask before you enter the facility. These steps will help the healthcare provider's office to keep other people in the office or waiting room from getting infected or exposed. Alert health department. Ask your healthcare provider to call the local or state health department. Persons who are placed under active monitoring or facilitated self-monitoring should follow instructions provided by their local health department or occupational health professionals, as appropriate. Discontinuing home isolation. Stay at home until instructed to leave. Patients with confirmed coronavirus should remain under home isolation precautions until the risk of secondary transmission to others is thought to be low. Talk to your healthcare provider. The decision to discontinue home isolation precautions should be made on a case-by-case basis, in consultation with healthcare providers and state and local health departments. Vaccines and treatment options for coronavirus are currently being investigated around the world. There's some evidence that certain medications like remdesivir, chloroquine, ritonavir may have the potential to be effective with regard to preventing illness or treating the symptoms of coronavirus. Clinical trials are done to examine the potential to fight the novel coronavirus.